Hello, everybody. My presentation consists of 4 parts. First, introduction. The second, clinical significance. Third, a little bit of science. And fourth, case reports. Metastasis is a complex multi-stage process, and circulating epithelial tumor cells, shortly CETCs, represent an intermediate stage of metastasis. Circulating epithelial tumor cells are defined as those tumor cells that detach from a solid tumor lesion and enter the bloodstream. However, only a small population of CETCs, called circulating cancer stem cells, is capable of surviving in the bloodstream and forming distant metastases. My presentation will be focused on this subpopulation of CETCs. Using Maintrac, we are able to accurately identify circulating cancer stem cells and estimate the risk of disease progression. The history of cancer stem cells, which is not very old, is briefly presented here. In 1855, a German pathologist, Virchow, postulated that activation of dormant embryonic cells leads to cancer. 150 years later, in 1997, there was a breakthrough in which cancer stem cells were found for the first time in acute myeloid leukemia. In the following years, cancer stem cells were identified in various solid tumors. What are cancer stem cells? Cancer stem cells replicate similar characteristics of regular stem cells, such as the ability to proliferation in their environments, self-renewal capacity, and differentiation into a heterogeneous population of cells. They are responsible for initiation, progression, recurrence, and metastasis. They are resistant to conventional chemo and radiotherapy, for which reason current treatments are not efficient, and strategies to eradicate cancer stem cells are an urgent topic in cancer research. Many technologies and assays have been proposed for the identification of cancer stem cells in primary tissue, including staining with cancer stem cell specific surface marker, or the hydrogenase activity test, and the sphere formation assay. But the gold standard for identification of cancer stem cells is in vivo model with xenotransplantation of tumor cells into immunodeficient mouse models. As an alternative to the mouse model, the chorioallantoic membrane, shortly CHEM assay, can also be used to obtain patient-derived xenografts from cancer stem cells. In 2006, we published as the first worldwide the method for detection of circulating cancer stem cells in blood of breast cancer patients and their clinical significance. Here you can see how we identify circulating cancer stem cells in the blood. Shortly, 1 milliliter EDTA blood after erythrocytolysis and 1 centrifugation step is cultured together with leukocytes in our medium supplemented with growth factors. After 2-3 weeks, floating 3D tumor spheres are visible in suspension culture. This type of growth is only typical for cancer stem cells. Tumor spheres grow continuously, and after 21 days of cultivation, they can reach a diameter of 40 to 100 micrometers. They have a specific and typical phenotype of cancer stem cells. A very important information is that no tumor spheres formation was observed in healthy donors. Here, a video through the single levels of tumor sphere. You can see that one tumor spheres consists of many cells, on average around 50 to 100 single cells. Tumor spheres cultured from CTCs had a typical phenotype of breast cancer stem cells. They are positive for CD44, low positive or negative for CD24, and have high activity of ALDH1. When can we say that the cell is breast cancer stem cells? The breast cancer stem cells must have a certain constellation of surface markers. The number of tumor spheres was associated with the clinical stage of disease. The total amount of tumor spheres was higher in the patient with metastatic disease, you can see here, as compared to patient without metastasis. The highest level of tumor spheres was observed in the patients group with multiple metastases. Our results indicate that the number of tumor spheres correlated significantly with the aggressiveness of the primary tumor. Patient with HER2 positive primary tumor had significantly higher level of tumor spheres compared to patient with HER2 negative histology. The number of tumor spheres was positively correlated with the proliferation index K67 and histological grade in primary breast tumor. Here you can see two clinical cases. On the left side, metastatic breast cancer patient with decreasing CTCs and tumor sphere during therapy with vinorelbine and tamoxifen. On the right side, increasing the number of tumor spheres and tumor cells and tumor spheres in breast cancer patient who, despite indication, declined cytotoxic therapy. Often in the case of patient with metastasis, we are unable to find circulating epithelial tumor cells due to low cell differentiation and loss of EpCAM antigen. But all metastatic patients without detectable CETC still had tumor spheres. In contrast, only in 66% of patients with CETCs, tumor sphere formation was observed. Now I would like to show you a little bit of science, and that circulating cancer stem cells are able to grow as a second tumor on chorioallantoic membrane and form patient-derived xenografts. Here you can see a microtumor derived from circulating cancer stem cells after 7 days of culture of CAM membrane. What is CAM membrane? CAM membrane is a highly vascularized and rapidly proliferating membrane around the chicken embryo that offers cancer cells replenishment of nutrients necessary for growth. It is important for exchange of gas and widely used to study tumorigenesis and angiogenesis. Here you can see a summary of advantages of using CAM system to compare with other animal models. It is easier to use. Growth of tumor cells can be visualized real time using very simple to highly complex techniques. Rapid vascular growth is very important for studying angiogenesis and screening of new potential drugs. it is a cost-effective solution with easy access. Very important for us, the circulatory system is completely accessible, making the delivery of intravenous molecules easy, reproducible, and reliable. Our first results about patient-derived xenografts from circulating cancer stem cells on chem membrane were published in March 2022 in Cancer. The experiment was divided into two parts. First, culture of tumor spheres. Second, obtaining patient-derived xenografts on chem membrane. Briefly, primary cultures were established from circulating cancer stem cells using sphere formation assay. Then tumor spheres were collected and transplanted onto the chem membrane of fertilized chicken eggs. After 1 week, we were able to observe secondary microtumors on chem membrane. Here you can see how a small microtumor develops on the chem from the tumor sphere suspension within 8 days, and also how the vessels are drawn towards the tumor. H and E and cytokeratin staining confirmed that we are looking at cancerous tissue. For this reason, we can now assume with a very high probability that our tumor spheres are indeed cancer stem cells, which are responsible for the formation of distant metastases. The second slide for the science, I would like to only show you that the success rate of tumor development on chem depended on the number of tumor spheres and aggressiveness of the primary tumor. Patients with more tumor spheres had much more frequently developed microtumors on the chem membrane. And also patients with a higher Ki-67 fraction in the primary tumor developed also more PDX model on chem membrane. Now we move on part with case reports. We prepared for you 3 cases. First case, here is the history of the first patient. 59-year-old woman diagnosed with moderately differentiated endometrial cancer. She was treated surgically with subsequent adjuvant radiotherapy. She had 5 years relapse-free survival. Unfortunately, in August 2019, she had a recurrence in her lung. The metastasis was removed from the lung, followed by chemotherapy. In December 2020, the patient had another relapse, a local and distant metastasis, again treated surgically with subsequent chemotherapy. At the time of the first Maintrac test, the patient had another recurrence in the liver. After surgery, we observed decreasing of CETC's number. In October 2021, the patient showed a slightly increased number of CETCs and very few tumor spheres. Clinically, she was in remission as well. Unfortunately, 5 months later, this is here the point, new lesion in liver was diagnosed, and Maintrac and StemTrac tests showed very high number of CETCs and tumor spheres. The number of tumor spheres suggested the presence of new metastases, and imaging scans confirmed disease progression and new lesion in the liver. the patient has been qualified for immunotherapy. After 2 cycles of pembrolizumab, the number of CTCs and tumor spheres remained at a very high levels, and further progression of lesion was observed. The administration of immunotherapy has been discontinued. The patient started a new treatment with paclitaxel weekly with a good clinical response, which is also reflected in Maintrac and Stemtrac tests. The second case report is a 5-year-old child diagnosed with synovial sarcoma. Tumor size was big, more 5 centimeters, without lymph nodes. So a surgical resection could be performed, and the remission was subsequently consolidated by proton therapy. And here, first Maintrac and Stemtrac tests were performed after surgery, and we observed a very high number of tumor spheres and no circulating epithelial tumor cells. After proton therapy, the number of tumor spheres decreased significantly, in contrast to CETCs, which increased to 150 per milliliter, as an effect of flushing out cells without proliferative activity from the remaining tumor burden. At the next follow-up examination, the number of tumor spheres and circulating epithelial tumor cells has stabilized at a relatively low level. The third case is a 32-year-old woman diagnosed with invasive breast cancer. Tumor size was small, less than 2 centimeters, and lymph nodes were negative. Tumor was estrogen positive, progesterone negative, and HER2 negative. The patient had surgery and received adjuvant chemotherapy. She is currently taking tamoxifen. And here the plot. The first Maintrac test was performed before starting chemotherapy and shows slightly elevated number of CETCs. In the middle of chemotherapy, both tests were performed, and the number of CETCs was minimally increased, and we did not detect any tumor spheres. And after the end of chemotherapy, the number of CETCs did not change, while the tumor spheres appeared in the next examination. The patient started with tamoxifen, and the next follow-up showed a decrease in both CETCs and tumor spheres. In conclusion, we are able to identify the most important subpopulation of CETCs with proliferative capacity and clonal expansion. As a sign of successful therapy, the number of tumor spheres can decrease concurrently with CETCs during chemotherapy. In contrast, increasing numbers of CETCs and tumor spheres might warrant further diagnostic steps in order to timely change or initiate therapy. In most cancer, distant metastasis, tumor aggressiveness, and poor prognosis correlate with the number of tumor spheres. Using the chem assay, we are able to confirm that the tumor spheres are the most aggressive and metastasis-initiating tumor cells. When is the testing of tumor spheres recommended? When the number of CETCs increases massively in complete remission to confirm.
Hi everybody. Unfortunately, the recording stopped here right at the end in the last slide for Dr. Pizon. What Dr. Pizon was alluding to was the utility of doing tumor sphere testing, and there are a number of occasions or situations where that might be useful. One is in the metastatic setting to confirm the aggressiveness and possibly the sensitivity to therapies for that, but I think a huge benefit it has on those at risk for recurrences cancers, where one wants to know the acute risk for recurrences to determine mid-term and long-term strategies. So if you've got any questions about tumor sphere testing or about testing for circulating tumor cells, please call us at Genostics. Phone number is Australia 1300 282 482, or email info@genostics.com.au. For further information, you can also visit our website genostics.com.au for any queries. All the best.